So out of curiosity, I decided to ask ChatGPT Plus if there were any states in the country that were now offering a telehealth license that previously did not. So quick search, and apparently Colorado, as of January 1st, 2026, is now offering a telehealth license for people that are licensed marriage and family therapists, professional counselors, social workers, apparently, in a state outside of Colorado. Obviously, their license has to be active and in good standing. So that allows them to provide services for people that are in Colorado, or people that are traveling to Colorado, but they are physically outside of Colorado. So it's not like a full license, but it does allow you to legally practice in Colorado. Now, the same proviso apparently applies, because I've looked up the website, and unfortunately the Department of Professional Regulatory Agencies in Colorado is down for maintenance as of right now. So today's March the 3rd, and it won't be back up until, according to the website, March 8th. So I think we have to wait till Monday, but it is tied to your main license. And you have to complete the Colorado Mental Health Professionals Jurisprudence exam, and you have to provide verification that you have an active license in another state, and you have to attest that you will practice telehealth only. So like the other telehealth licenses, you cannot provide service physically in Colorado, like in an office to a Colorado client. And you need a registered agent in the state of Colorado. So registered agent, basically, who's physically in Colorado, is authorized to receive any government communication on your behalf, since you don't live there. And the website also indicates that the license is valid and it renews on odd years. So I have to double check, because it's a little late, but I'm kind of tired. So that is the lowdown so far on this. I can't find anything on fees because the website's down. Now, these telehealth licenses, they're less paperwork heavy. They're nowhere near as expensive as it would be to go and pursue a full license. And if you are totally fine being completely telehealth only and have no plans to move to the state that you hold a telehealth license, then great. But if you were to move to that state and become a resident, you would have to pursue the full license, which is more expensive, maybe a bit more paperwork, but that's Colorado. And yeah, I also did a search on which states would be the states, if you were a licensed mental health provider, whether a physician or not a physician, what states would be kind of like probably the most lucrative in terms of fairly regular referrals based on demand and supply. And California's still on there, Florida's on there, Illinois, North Carolina are the states that came up. So it keeps switching, but I would say that it would be great if there was just this national compact, and then somebody could, like the SIPAC exists. SIPAC for licensed psychologists is like that. Now, the SIPAC's great, but apparently California is not part of SIPAC. So so it's great for people that live in a state that has signed up to be part of SIPAC. But if the way SIPAC works is that you apply for permission under this compact, and there's been work on a social work compact, an LMFT compact, but California is apparently not joining. And then there's a counseling compact for people that are LPCs. And I think so far California looked like they were going to introduce a bill, but I haven't heard anything about that since. So these kind of mobility access points are great, because clients travel. Sometimes clients will suddenly have a work or some kind of opportunity where they're literally dividing their time between two states, like split evenly, and people are so used to telehealth now. So nonetheless, this is this is great. It's one more state to add if somebody wants to even just see their existing clients who like to go to like to go to Colorado a lot, to go skiing, and spend significant time there. So hopefully one day we will have some kind of like national or regional kind of pack, because yes, each state will have some nuances with their legalities, and that obviously is something to consider. But people move around, even if they don't relocate. People are pretty mobile, and if you think about it, you can lose a lot of revenue in terms of billable hours if if your clients routinely go to another state. Like, for example, Nevada, California is a really good license to hold, because if you're practicing near like Tahoe or within an hour from the Nevada border, you very likely can have clients that frequently go to Nevada. And if you can see them, whether they're on one side of Tahoe or the other, it's great. It's good for the client. It gives continuity. But there you go. Colorado has joined the telehealth option, and you just got to take the jurisprudence exam. So when the website is back up, I'm going to double check and see just how much all this is going to cost. Generally, it's not as costly, but we shall see.